No one knew across the organization, across the world, period, what COVID was, what was happening, how to handle it.
We all felt like we were in a pretty comfortable position. We knew we needed to be aware of it, but it didn't feel like it was going to hit us anytime soon, and then overnight it did.
It was really unbelievable. I couldn't believe it was happening. You didn't want to believe it was happening here in Albany.
I think we're all trying to just figure out, what can we do?
Immediately, we as an organization were trying to figure out how are we going to, what processes and things are we going to put into place.
Initially, I started out and I said to my team, this can make us or this can break us. This is going to be a test of time of to who we really are and how well we really pull together.
Now, with me, it was like in March, it hit. In the first couple of weeks, it was chaotic. It was just, then we developed at AAPHC the COVID team, so we were meeting, trying to be proactive instead of reactive, but a lot of things were reactive because people just didn't know, or we didn't know it was a new situation for everybody. There's no model to follow.
I think one of the hardest parts is that it was changing every day. So you're having to adjust every day to something new. There's a new piece of information out there. And I think one of the harder things too is that, you have all these different sources of information. So you're trying to figure out, which one's correct. Lives are really on the line, and you need to make a split decision on who we're gonna trust or how we're gonna navigate this new threat landscape that's ever changing.
So it was very important to remain open to make sure that all patients have access to care, to make sure that patients may have uncontrolled blood pressure, are diabetics, or have any type of chronic issues, asthma, etc., to make sure that they continue to be well taken care of, even patients that were coming in for their wellness exams. So it was very important for us to make sure that patients have that continuous access to care to keep the community healthy.
Yeah, you were worried because patients just simply weren't coming into the office. And so how do you make connections with those patients? And our providers were worried about their patients. And we had already been kind of brainstorming the possibility of some type of home care program. We just jumped on how much would it cost for us to have a simple kit, blood pressure cuff, a pulse ox for patients to measure, their oxygen saturation, and a thermometer. Thermometers were very hard to get during that time. You could not just go and get a thermometer. And so I got this email one day from our grant writer and with our organization, and wanted to know some specifics. And so just kind of sat down and wrote, what we went through and how it just kind of evolved. And lo and behold, they did award the organization with an innovation award. I think they only offer 3 every year in the United States. And so that was, really great for the organization. I think it shows the value of a community health center.
So definitely, during the time of COVID, a lot of parents had a lot of concerns for good reason to not want to utilize healthcare in person to decrease their risk of exposure. I do feel very blessed that, in the school-based health center realm, we've been able to really ensure that healthy students and patients are cohorted basically, so that way you're not in contact with anyone who is ill when you come for your general care or for vaccinations. We've always focused very heavily on universal precautions, so working on making sure everything is sanitized in between patients, and so that was already a protocol that was in place, but certainly COVID has heightened our awareness of that, and so we definitely want people to feel comfortable getting those necessary checkups and vaccines.
So during that time, basically I worked with the patient navigators, referral specialists. So really my shift during that time was, how do you actually figure out how to get the patients back in? And how do we make the patients feel safe about coming in? Telemed was of course, the first thing. Also working with our dental staff. We closed that clinic down. So transitioning that staff over to our administrative office and then giving them a job as navigators now at this point?
I'm really most proud of our staff and our providers being really intrepid and continuing to come into work knowing that they were facing danger. I never once had a lot of providers coming in telling me they just weren't going to come into work, that it was just too scary. If anything, they were concerned about the patients coming into the clinic and being exposed and wanted to know if we could get our virtual telemedicine visits going faster, which we did. But they were brave for continuing to come into work, facing a situation that they knew they would be exposed to a deadly virus just about every single day. Made me proud to be a part of this organization, Albany area, primary health care.
I think we all took a lot of things for granted before the pandemic hit, and hopefully we now appreciate the little things, good health, coming in, not having to wear a mask, being able to see the smiles, the frowns, just appreciating each other.
As I went home every night, I said, this is truly a test of leadership skills. This is something that you never dreamed you would be faced with, especially when you have 370-something employees. And of course, they're in a healthcare, so they're in a field, they're exposed, they're going to have potential risk of contacting this disease. And so I wanted to make sure my people, and my people are my staff, and my people are my patients. And so I would always tell them I had two priorities. I had my patients and my employees. Those were the two things I always woke up with in the forefront of my mind is, how am I going to take care of them today? As Dr. Haas always told me, he's like, we're like the Marines. And I never really kind of got that until the pandemic. And I was like, okay, y'all, it's time to man up. This is the Marines. We're going to fight this battle. We're going to fight it together. And this is what we do. We don't close our doors. Again, 100% staffed, 50% production. So we continue to make sure we do what we can for the community.